Welcome back to KVUE News Midday. The FDA gave final approval to the Pfizer vaccine yesterday, and that has many health leaders pushing people to get the vaccine. Dr. Suneet Singh, medical director with CareHive, joins us now to talk about what this all means. Thanks for being here.
Oh, it's a privilege to be here. Thank you for having me.
So this final approval of the vaccine is pretty fast. Let's face it, it takes years for most vaccines to get to this point, and this third phase of the trial is ongoing. So what do you say to people who worry that we don't know the long-term effects of the vaccine and probably won't for years?
You know, I really have to put my faith in the FDA. It might sound like it was a rushed process, but the truth is the technology has been around for several years. There have been other medications that have also been using the mRNA technology. And the FDA first gave their emergency use authorization, as we know, a long time ago at this point, but they kept going with their rigorous standards. And they looked through over 100,000 pieces of documents to look at the research. They studied over 40,000 people internationally. They went to the actual manufacturing plants to look to see where the vaccine is being made. And it has definitely passed all the rigors that they always do for any other medication search. So I would say that this is a very well-studied drug. It's a very safe drug. And it's a very effective drug.
Can we talk a little bit about the booster shots too? I know there's been some discussion of getting immunocompromised people these boosters, and maybe possibly everyone else later this fall a chance to get a booster 8 months after they receive their second shot. What do you tell people about the need for that right now?
You know, what we've seen is there is a waxing immunity that comes after the initial series, and there's been a lot of research into it. And what we're seeing in the general population is that point tends to be at the 8-month mark. And so the Health and Human Administration has said that they recommend the general population to receive that booster at the 8-month mark. Now, the FDA is also looking at the research, and they too are expected to sign off on this, and that would give the general population access to the booster around September 20th. And I can tell you here in our community, Austin Public Health has already started the process of planning a well thought out rollout for our community. Now, meanwhile, the FDA has already approved the booster shot for the immunocompromised. So that includes people who've had a solid organ transplant, stem cell transplants, people who are on medications that are designed to weaken the immune system to treat conditions. And for them, the FDA approval is already in place. So yes, I would recommend that if you are eligible to receive a booster, now's the time to get it.
We are seeing some breakthrough cases, even with people who have been vaccinated. 3,642 breakthrough cases reported by Austin Public Health. But it's a little misleading because I know, for instance, like the CDC changed the definition of breakthrough cases several times through this process. Do we really know how many breakthrough cases we have?
You know, it definitely is hard to actually give a hard number to that. And what we're seeing in the dashboards nationally as well as here locally is that the number of cases has started to go up once again. We thought we were about to go down, but once again, the latest numbers show that the number of COVID cases are going up. And that does include people who have already previously received a full vaccination series. So though we might not have a hard and fast number, if we go by the directional changes, we do see that, yes, there are people who have been vaccinated who are unfortunately coming down with COVID.
We've talked a little bit about the school cases and cases of children starting to test positive in schools. Just today, Austin Public Health gave some new numbers about how many children in our own area have ended up in local hospitals since between July 1st and August 22nd. They tell us 90 children have been admitted to area hospitals, 26 of those admitted to ICU during their stay, and 1 child was put on a ventilator. Is there a reason why we can't get actual current numbers of children in the hospitals?
You know, it just comes down to reporting. As you can see, through COVID, it just wasn't a disease that was hitting the pediatric population as much as it was to the adult population. So even though the numbers were being reported, because the numbers were just so small in relationship to the general population, it wasn't that we're trying to hide it by any means. The numbers were just minuscule. Now, the Delta variant is a lot more contagious and it is a lot more virulent, and we are seeing the pediatric population, unfortunately, being more susceptible now than at any point in time during this pandemic. And that's why we're now starting to see some of these numbers being reported, because they are starting to hit a number that is a little bit more substantial to report.
A lot to take in and cover every single day. Dr. Suneet Singh, Medical Director of CareHive, we really appreciate you joining us today.
Well, once again, thank you for having me. I really do appreciate you.